Essential services include: Number 1. Dispensing, which is the supply of medicines and appliances ordered on prescriptions, together with information and advice to enable safe and effective use by patients and carers, and maintenance of appropriate records. Number 2. Repeat dispensing, the management and dispensing of repeatable prescriptions for medicines and appliances in partnership with the patient and the prescriber. This service specification covers the requirements additional to those for dispensing, such that the pharmacist ascertains the patient's need for a repeat supply and communicates any clinically significant issues to the prescriber. Number 3. Disposal of waste medicines from pharmacies. This involves the collection and safe disposal of unwanted medicines returned to pharmacies by the public or by residential homes. Number 4. Promotion of healthy lifestyles. The provision of opportunistic lifestyle advice even on an individual patient level, especially to those patients having long-term conditions such as diabetes. In addition, it is the proactive participation in national and local public health campaigns to promote public health messages to general pharmacy visitors during specific targeted campaign periods. Number 5. Signposting. The provision of information to people visiting the pharmacy who require further support, advice, or treatment which cannot be provided by the pharmacy, on other health and social care providers or support organizations who may be able to assist the person. Where appropriate, this may take the form of a referral. Number 6. Support for self-care. The provision of advice and support by pharmacy staff to enable people to derive maximum benefit from caring for themselves or their families. The first advanced service within the community pharmacy contract is the Medicines Use Review and Prescription Intervention Service. The service consists of accredited pharmacists undertaking structured, concordance-centered reviews with patients on multiple medicines, particularly those receiving medicines for long-term conditions. The MUR process attempts to establish a picture of the patient's use of their medicines, both prescribed and non-prescribed. The review will help patients understand their therapy, and it will identify any problems they are experiencing along with possible solutions. A report of the review will be provided to the patient and to their general practitioner. Enhanced services include: supervised administration of prescribed medication, needle exchange services, palliative care support, stop smoking services, care home support, medicines assessment and compliance support, medication review, minor ailment service, out-of-hours access to medicines, supplementary prescribing. A healthcare team is the group of people who share a common health goal and common objectives determined by community needs. On the scourge of many spurious, duplicates, and adulterated drugs, it is in the hands of the pharmacist, particularly the community pharmacist, to take up the challenge for providing better health care and better outcomes economically. The pharmacist in the healthcare system is like circumcenter of a triangle with physicians, patients, and nurses at the corners of the triangle. He has direct contact with all healthcare professionals and patients. It is really important to appreciate the fact that a patient finds himself to be much more comfortable in a drugstore than in a physician's dispensary. The role of community pharmacist is indispensable in providing better health care. Steps should be taken by the government and the pharmacist himself to make his recognition in the community as a better health care provider. The main driving force will have to come from pharmacists themselves. They are best able to decide what can be achieved and within what time scale. Every community pharmacist should always remember the following lines. Do all the good you can, in all the ways you can, in all the places you can, at all the times you can, to all people you can, as long as ever you can.
When a prescription is written for a drug or treatment, the next step for the patient is usually a visit to the pharmacist.
Be a few minutes, okay? Thank you.
And while for most people that often means going to the local drugstore, hospitals and community clinics have pharmacies as well. Typically, pharmacists spend most of the day standing at a counter, dispensing medication. They may also compound the medication, though this is now a much smaller part of a pharmacist's practice. While many of the drugs they handle are pre-packaged by manufacturers, pharmacists are expected to understand the ingredients and how they might interact with other medications. This is a profession that requires careful attention to detail. Making a mistake and dispensing the wrong medicine could have life-threatening consequences.
Okay, sir, your prescription's all set. What the doctor wrote is medication to help you sleep.
Part of the job is being able to explain to people how the prescription should be taken or administered, and providing information on drug interactions and side effects.
Just be careful when you wake up in the morning. Sometimes you might feel a little hungover, a little drowsy.
There's also a lot of paperwork involved. To study to become a pharmacist, you must first prove your aptitude in science and math by passing the Pharmacy College admissions test. After earning a Doctor of Pharmacy degree at a college or university, pharmacists then need to be licensed by the state. With additional education, pharmacists can move into administration or teaching. They can even do research to develop new drugs. But the goal is the same: helping people get the medications they need to get well and stay healthy.